Hi and welcome to Introduction to the Health Benefits of Tocotrienols. I'm your presenter, Dr. Brad McKeown. So in this presentation, we're going to be discussing what is vitamin E, what are the tocotrienols, what are the functions of tocotrienols, and what are the uses of tocotrienols. So let's start off with what is vitamin E. Vitamin E is a fat-soluble vitamin along with vitamins A, D, and K. Vitamin E has 8 different isoforms that belong to 2 different categories, being the tocopherols and the tocotrienols. So what are tocotrienols? So tocotrienols are a vitamin E that is more readily transferred and incorporated in cell membranes than tocopherols. The unsaturated side chain of the tocotrienols allows for more efficient penetration into tissues that have a saturated fatty layer, such as the brain and the liver, most organs, and distribute more evenly in lipid membranes. Cellular uptake of tocotrienols is anywhere between 50 to 70 times higher than that of tocopherols, and tocotrienols have a higher peroxy radical scavenging activity than tocopherols in liposomal membranes. So what this means is in cell membranes, we have these different peroxy radicals that cause a lot of sort of inflammatory oxidative damage to cell membranes. Tocotrienols have this greater quenching effect with their antioxidant capacity to reduce that damage that is being caused. So going into further detail here, we've got the inside of the cell, the top part of the screen, I want you to imagine, and the outside of the cell being the bottom half. And in between we have our phospholipid bilayer. So we've got the heads and the tails of phospholipids. This is our cell membrane that holds everything in, I suppose, and holds everything without. And in this case, I want you to imagine, due to the flexible nature of the tail of the tocotrienols, it's able to make its way through the cell membrane more effectively, protecting it from the inside out. So tocopherols have a way of protecting and having an anti-inflammatory, antioxidant effect on the outside of the cell membrane, while tocotrienols, as well as astaxanthin, can actually make their way through the layer and protect it from the inside out, which is fantastic for a lot of chronic diseases, particularly inflammatory diseases or diseases with a lot of oxidative stress. And there it is moving inside the cell. So what are the functions of tocotrienols? So I want you to think back to when we looked at 5-MTHF, that a lot of the effects of some vitamins and minerals and amino acids and other nutrients have a scaffolding effect, that they work on the background activity that you don't always physically see. In this case, the tocotrienols have antioxidant properties, anti-inflammatory properties, lowering cholesterol, as well as regulating and modulating the immune system response. It has a way of regulating blood glucose levels, as well as protecting the liver, the kidneys, and the nerves from damage via antioxidant and anti-inflammatory pathways. So some of the uses of tocotrienols, we're looking at oxidative stress. So I want you to imagine oxidative stress is a natural phenomenon in the body. With oxidative stress, we actually create energy in our Krebs cycle, electron transport chain, even glycolysis pathway. We use this oxidative stress to create energy, ATP production. However, oxidative stress can be when there's an imbalance between our antioxidant defense system and antioxidant capacity versus how much of these free radicals and oxidative stress mediators are actually being formed. And then that's when there's a big issue. So generally, if it's well balanced, the body's running smoothly. But when there's an increase in oxidative stress, that leads to damage to the cells or the tissues, for example, as well as a greater inflammatory different state. So with tocotrienols having an antioxidant property, it has a way of protecting the cell membranes from damage. Going back to what the last slide was, from the inside out and the outside in. It's quite exciting the way how this works. Inflammation, again, is a normal, general, everyday response. It's the immune system response, as well as the body's general response to pathogens, damaged cells, toxic compounds, and radiation. But it's also a response to normal everyday life, that there is inflammation. So I want you to imagine you're going for a jog and you twist your ankle. Inflammation is caused. That there is actually meant to start the healing process and sort of provide a bit of pain to sort of say, hey, stop, allow this to heal. Because inflammation and pain don't always go hand in hand, but it's a bit of a process. We need that inflammatory response to clear the debris, to start the healing process. However, when that inflammation is dysregulated, it can lead to more fire, leading to cellular damage, inflammatory damage to tissues and organs, for example, and development of chronic diseases such as atherothrombosis, cardiovascular disease, cerebrovascular diseases, and quite a lot of other chronic diseases. Inflammation is a further stage of this process that the body's trying to work with the healing process. So if we look at the different mechanisms, we've got all these different molecules that, as you can see on your screen, C-reactive protein, tumor necrosis factor alpha, all the different interleukins, cyclooxygenase 2 particularly, these all mediate inflammation. And as part of that process, we work with general inflammation for healing processes, general inflammation to work with toxic stages, invading pathogens, as mentioned on the previous slide. But when that gets too much, we get the firestorm of inflammation. Research is suggesting that tocotrienols have a way of dampening that inflammatory effect by having this anti-inflammatory result and dampening the effect of these inflammatory mediators. It's quite exciting. It's a relatively new area that's being looked at, and I'd love to see a lot more research into this result, particularly if it has a modulating effect on the immune system and in the inflammatory pathways, because that is really useful, in particular when we look at autoimmune diseases and other different states. Cholesterol, so I want you to imagine that hypercholesterolemia. So like I said in other presentations, anytime you don't understand a big word, I want you to break it down. Hyper meaning elevated, increased or high. Cholesterol, it's cholesterol. Emia meaning blood. So in this case, we're looking at elevated levels of cholesterol in the blood. It's one of the most common health conditions around the world. It's a major risk factor for cardiovascular disease and having negative impacts on the myocardium, so the actual heart muscle itself, in development of atherosclerosis and that of other chronic disease states. So cholesterol itself is seen again as one of the bad guys, but I want you to also remember you got your HDLs, the LDLs, VLDLs, lipoprotein A, you've got all these different cholesterol families, you might say. The HDLs are what we typically see as the more positive. They are the anti-inflammatories of the cholesterol and seem to be able to clean up or mop up a lot of the different inflammatory damage, I might as well say. In the cases of the LDLs and VLDLs, I see them as carriers. They actually carry, and the chylomicrons actually carry a lot of A, D, E, and K. They carry a lot of nutrients out towards the body. But when they become too sort of numerous, it leads to foam cell formation, atherosclerosis, atherothrombosis, and occlusion of the artery, and therefore the cellular death in the area, heart attack, stroke, etc. I can go on for more on that, but I'll cut it a bit short there. But one thing I want you to think about is with a lot of chronic diseases, you have inflammation, oxidative stress, and typically in the background, elevated cholesterol levels. So with the effect of tocotrienols having this cholesterol lowering effect, it has this ability to inhibit an enzyme pathway, HMG-CoA reductase, or the longer version of it, 3-hydroxy-3-methylglutaryl coenzyme A reductase, which is an enzyme that's rate limiting in the pathway to cholesterol biosynthesis and the production of cholesterol intermediates. So in this case, if we can reduce the level of elevated cholesterol being formed, could we see a greater impact on chronic disease reduction? That's one of the things I'm thinking of. More to tell in the future. So thank you for watching this brief presentation on the introduction to the tocotrienols. I'm your presenter, Dr. Brad McEwen. I'm a naturopath, nutritionist, herbalist, educator, and researcher. Here are some of the references I utilised while putting together this brief presentation. For more information, go to your local health food store, your local GoVita store. And just as a reminder, this presentation is for informational purposes only. It's not a substitute for medical advice. If symptoms persist, talk to a health professional, follow directions for use. Thank you, and I wish you all the best.